What is the cheapest Medicare plan? Or rather, we should say what is the least expensive, because cheap implies poor quality, and that's definitely not what you want in a health insurance plan. We're going to go over that in today's video. Stay tuned. Hi there, and welcome to our channel. My name is Sarah, and I'm here today with iHealthBrokers to help you find the least expensive Medicare plan. Now, if this is your first time to our channel, welcome. Please make sure to take a look around because we've got plenty of videos about Medicare and health insurance in general. And of course, make sure to subscribe to stay up to date because we do release these videos on a weekly basis. You can also find us on Facebook. We have an iHealthBrokers page, as well as a Medicare-related iHealthBrokers group where we answer questions about Medicare and post Medicare-related news. So make sure to check us out. And you can also find us on Instagram, Twitter, and TikTok. And as always, please make sure to like this video. Liking this video will make it more visible to others who are looking for the same type of information, and we want to get this information out there. And if you have any questions, you can reach us in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. We're licensed nationwide, and there's absolutely no charge for our services. All right, so today we're going to be talking about how to find the cheapest or least expensive Medicare plan. Let's start with Original Medicare. Original Medicare is Medicare Part A and Part B. You'll most likely be automatically enrolled when you turn 65. Original Medicare is not offered by private carriers, so you can't actually shop around to find the cheapest or lowest price plan, but what you can do is make sure to stay on top of your tax returns. So Medicare Part B does have a monthly premium, and the amount that you pay is based upon your income. However, Medicare is looking at your income from 2 years prior. It's looking at your tax returns from 2 years ago. So if you've retired and you're now making less money than you were before, you definitely want to file Form SSA-44. I'll put a link in the description below, because that will encourage Medicare to take a look at your new income and reevaluate exactly what your monthly premium should be. So definitely make sure to stay on top of that. Other than that, there's really no way to save money or pick the cheapest plan for Original Medicare because there's just no other option other than what's offered. However, if you do choose to enhance your Medicare coverage with Medicare Advantage, Medicare Supplement Plans, or Medicare Part D, there are definitely options, and that's what we're going to talk about right now. So let's start with Medicare Supplement Plans, because Medicare Supplement Plans are definitely the most popular enhancement that people choose. There are a variety of plans that you can choose from, many different letters. I'm sure you've heard of them. And let's break it down a little bit so that way you can understand exactly how to pick the cheapest or less expensive plan if you're going the Medicare Supplement route. So first and foremost, you need to understand that Medicare Supplement Plans are standardized. So it's very important that you pick the type of plan that works for you. After that, you get to pick your carrier. But it really doesn't matter as much who your carrier is, because whether you go with Aetna or United or a different carrier, the benefits will be exactly the same. If you pick Plan G, your benefits will be the same regardless of who your carrier is, as long as you have Plan G. Now, of course, there are things to take into consideration. You want to pick a carrier that has a history of low, stable increases so that you're not met with sticker shock the next year. However, first and foremost, the most important thing is to figure out what plan best suits your needs. And that's really the theme of today's video. You want to make sure that you pick a plan that suits your needs, because even if you pick the quote-unquote cheapest plan, if it's not right for you, you're going to end up spending way more money than what's necessary. So there are a couple of options for Medicare Supplement Plans. Many different letters. We break it down in another video all about Medicare Supplement Plans, which I will put in the description below. But right now, I want to focus on just a few. So let's start with Plan G. Plan G is the most comprehensive coverage available to new Medicare enrollees. Basically, it's going to cover all of the gaps of Original Medicare, except for the Part B deductible. Anyway, the way Medicare Supplement Plans work is that they cover the gaps of Original Medicare. Original Medicare will cover most of the costs, but leave you with a portion of it, and the Medicare Supplement Plans will cover the remainder of those costs. So with Plan G, really the only thing that you have to worry about is paying your Plan G monthly premium, paying your Part B monthly premium, and meeting that $217 deductible. So is this the cheapest option? Is this the least expensive option for you? Maybe. This is certainly the best option for somebody that needs comprehensive coverage that may have extensive medical needs, because basically all you have to do is add your Medicare Part B monthly premium to your Part G monthly premium, multiply by 12 because that's your yearly cost, and then add that $217 deductible that you have to meet, and that is your yearly cost for your health expenses, period. That's it. There's nothing additional. So when we look at Medicare supplement plans, generally speaking, they range somewhere between $50 to $200 per month. That's just an average. There's always outliers. But let's say you were to get a plan that's about $100 per month for Plan G, and then you have that $148.50 Part B monthly premium. Multiply by 12, add $217, you're looking at roughly about $3,000, give or take. That would be your total expenses for the year. So if you're someone that has large medical needs, maybe you see multiple specialists or you have surgeries coming up, then Plan G might be the way to find the cheapest Medicare coverage for you. The next plan that I want to talk about is Plan N. Plan N is almost identical to Plan G, except it doesn't cover Part B excess charges. So Part B excess charges are exactly that. Some doctors choose to charge more than what Medicare will cover, and if your doctor does and your supplement plan does not cover those Part B excess charges, then you're responsible for that additional cost. However, as an aside, in some states, there are no Part B excess charges, and it's pretty rare to find a doctor that does charge them. However, if you want peace of mind that the entirety of your medical costs will be covered, then Plan G is still the one for you. Plan N, almost identical, except for those Part B excess charges. So if you feel comfortable with those Part B excess charges, and you can find a Plan N that has a much lower monthly premium than a Plan G, then that might be the way to find the cheapest Medicare plan for you. Okay, the last two plans I want to talk about are the cost-sharing plans. So this is Plan K and Plan L. As I said earlier, Medicare will cover most of your costs. When we're looking at Medicare Part B, Medicare will cover 80% of the costs, leaving you with 20%. That 20% is your coinsurance. Plan G and Plan N will cover that coinsurance. Plan K and Plan L will cover a portion of that coinsurance. So if you want to sort of split the difference, you maybe want lower monthly premiums, you're willing to pay a little bit when you have to use services, then maybe you want to go with one of those cost-sharing plans. Again, the best way with Medicare supplement plans to find the cheapest plan is to first determine your needs. Now, the next way to find the cheapest Medicare plan for a Medicare supplement plan is to use a broker. I mentioned this earlier. Medicare supplement plans are standardized, so the benefits do not change from carrier to carrier to carrier. What changes is the price. So I would highly encourage you to use a broker. A broker can help you comparison shop multiple different plans offered by multiple different carriers to make sure that you are getting the lowest monthly premium with a reliable carrier. If your doctor accepts Medicare, they accept your supplement plan. It doesn't matter who your carrier is. So go ahead, contact a broker, someone that you feel comfortable with that can help you find the best plan for you. And many brokers don't charge an additional fee for their services. We don't. So if you'd like our help, you can reach us at iHealthBrokers at 888-410-0344. Like I said, there's no charge, but we will help you comparison shop and make the whole process a lot easier and less expensive. Now let's talk about Medicare Advantage plans. Medicare Advantage plans are a whole different ballgame. When you enroll in a Medicare Advantage plan, you're actually giving up your original Medicare coverage in favor of one of these types of plans. Now, a lot of people get suckered into a Medicare Advantage plan because they boast that they are free. Are they free? No, absolutely not. You still have to pay for your Medicare Part B monthly premium at the very least. Medicare Advantage plans often offer additional benefits not offered by Medicare Supplement plans. These are things like dental, vision, hearing, prescription drug coverage, and more, so it can make them very, very appealing. However, you need to know that you're giving up access to that extremely broad Medicare network. So how does this come into play with regards to finding the cheapest Medicare plan? Well, it's very simple. If you're looking at a Medicare Advantage plan in comparison to a Medicare Supplement plan, and you're thinking, well, with a Medicare Advantage plan, I get dental, I get vision, I get hearing, and I don't have to pay anything additional other than my Part B monthly premium, why would I go with a Medicare Supplement plan? Well, it's pretty simple. The Medicare Advantage network is much, much smaller. It's entirely dependent upon your carrier, unlike Medicare Supplement plans. That means that if your doctor or your specialist that you see is out of network, you may be out of luck because most Medicare Advantage plans are HMOs. So you need to operate within network. So how does that affect the cost? Well, if you pick a plan and it doesn't cost you any additional money, but you're not able to utilize any of the services because the doctors and specialists that you use are not in network, that's going to end up costing you way more. But let's say you've thought it out and you've done your research and a Medicare Advantage plan actually is right for your needs. It really depends upon your needs and the area of the country in which you live. So if a Medicare Advantage plan is right for your needs, you need to figure out how to pick the least expensive plan. The first thing, of course, is to look at the premium. That is the easiest thing to identify. Many Medicare Advantage plans say that they are free. As we said, they're not. But many of them do offer a $0 monthly premium. You just have to continue to pay for your Medicare Part B. Now you need to look at the coinsurance and copays. Medicare Advantage plans are only required to offer the same benefits as original Medicare, meaning you could be on the hook for that 20% coinsurance for certain services. Some plans are better than others, so make sure to look at the fine print. Again, this is why we recommend working with a broker. Next, you need to look at the benefits. Medicare Advantage plans offer a wide variety of benefits that can vary quite significantly from plan to plan and carrier to carrier. Additionally, they can change on a yearly basis, meaning you may need to pick an entirely different plan during the next annual enrollment period. So make sure that whatever your needs are, your plan's benefits most closely match those needs. Pay particularly close attention to dental because if your plan does offer dental, you need to make sure that your dentist is in network. And you need to make sure if you require any type of specialty treatment that it's covered by your plan. Dental is an area where a lot of people get majorly tripped up. While we're talking about benefits, many Medicare Advantage plans offer prescription drug coverage. So you need to see what exactly might be the costs associated with the prescription drugs that you take. And of course, make sure to look into those deductibles because some Medicare Advantage plans have a separate deductible for prescription and for healthcare benefits. Some combine them, some have higher deductibles, some have lower deductibles. So again, we're looking at monthly premiums, benefits, copays and coinsurance, and the deductibles. And the last thing that I want to talk about is the out-of-pocket max. Now, all Medicare Advantage plans will have an out-of-pocket maximum, which is a great thing because original Medicare doesn't have an out-of-pocket max. So even though you're only paying for a small portion of your covered services, those can begin to stack up, and if you have extensive medical needs, there is no out-of-pocket max, which means you'll be on the hook for the entirety of the bill. With Medicare Advantage plans, there will always be some type of out-of-pocket max, so take a look and make sure it's a number that you're comfortable with. Also, as a reminder, that is on a yearly basis, so that means the next year it's going to reset. This is very, very important for people with illnesses that are chronic or difficult to treat. For example, people that are struggling with cancer. Well, if your cancer treatment takes more than a year, or even if it just goes from December to January, that out-of-pocket max resets. So that's something very, very important to take into consideration. Finally, with regards to Medicare Advantage plans, I want to talk about some of these special types of Medicare Advantage plans. These would be D-SNPs and C-SNPs. So D-SNPs are dual eligibility special needs plans. These are plans for people that are eligible for Medicaid and Medicare. If you are eligible for Medicaid and Medicare, we strongly encourage you to look into one of these types of plans because this is definitely a way to find the least expensive Medicare plan. Now, C-SNPs are chronic special needs plans. These are for people that have certain chronic illnesses. We've got a video entirely about that. I will put that in the description below. If you're someone that struggles from one of these chronic illnesses, then a C-SNP might be right for you because you'll find lower copays, lower coinsurance for specialists that are related to your condition and medications that are related to your condition. And speaking of medication, if you're someone with diabetes who takes insulin for your diabetes, you may want to look into an insulin saving plan. That's one of those senior saving models plans that offers a 30-day supply of insulin for $35. Again, it has to be certain insulins and it's only certain plans, but if this is a need that you need addressed, make sure you take that into consideration when looking at your plans. Finally, there's Medicare Part D. Medicare Part D can be confusing, but it may be the easiest to shop for because it's federally regulated. So it's offered by private carriers, but there are certain criteria that all plans must meet. So let's break down Medicare Part D plans. You have to take into consideration your premium, your deductibles, and of course, your copays or coinsurance. For Medicare Part D, the first thing we'll look at is the monthly premium. And the monthly premiums can vary quite widely, so you want to make sure that you find a plan that fits in your budget and feels comfortable with you. The next thing that you look at are the pharmacies and prescription drugs. You need to make sure that the pharmacies that you use are in-network. This is sort of like what we talked about earlier with Medicare Advantage. If the pharmacy that you need is out of network, even if your plan is very inexpensive, it's going to end up costing you way more in the long run. So make sure that the pharmacies that you use are in network. Also, you need to take a look at what the costs might be for the prescription drugs that you take. There are 5 tiers of prescription drugs. We've got a video all about that. I'll put that in the description below as well. But there are 5 tiers of prescription drugs. So you want to check out where exactly your prescription drug falls and what the copay or coinsurance might be. A disclaimer, this is really just a guide. Sometimes there can be slight discrepancies, but it'll at least give you a pretty good idea of what your costs might be. Also, we want to take a look at the deductible. So every year, Medicare sets the max deductible that any plan can charge. This is the amount that you have to meet out of pocket before your insurance kicks in, and you'll be responsible for copays or coinsurance at that point. Now, some plans offer lower deductibles than others. However, generally speaking, that is balanced with a much, much higher monthly premium. So run those numbers, because just because it offers a $0 deductible, if the monthly premium is $100 more per month, it's probably not going to work out in your favor. I hope you liked today's video, and if you did, please make sure to give it a thumbs up so we can get this information out there. Now, I do have to mention that in today's video, of course, we were talking about how to find the cheapest, least expensive Medicare plan. But there are other ways to save money on Medicare, things like avoiding late penalties or possibly taking advantage of Medicare Savings Program and the Extra Help Program if you qualify. Those programs are, of course, based on your income. We have other videos about that, and I will put them in the description below. If you have any questions, you can reach us here at iHealthBrokers at 888-410-0344. We are licensed nationwide with over 200 carriers, and there is no charge for our services. And of course, make sure to find us on Facebook, Instagram, TikTok, and Twitter. And if there are any videos you'd like to see, let us know. If not, we will see you next time. Thanks for watching.